My name is Carla Perna, and I am a clinical oncology consultant working at the Royal Surrey in Guildford. I also work at Frimley Park Hospital, and I do work in London and different areas covering most of the Surrey area within my private work. I am a specialist in uro-oncologist, particularly prostate and testicular cancer, and stereotactic radiotherapy using the newest techniques such as MRI-guided machine. I do come from a family of doctors, which could be the reason. I grew up in an environment where medical terms were discussed at the table. My dad was an oncologist, and I think I may have just grown this desire in myself to be a doctor myself. And then growing up, I decided to take medical school, and I'm still very passionate about my job. And I think that I have made the right choice. After all of these years, I'm still not regretting that. And I'm still very happy to continue to improve and always growing in my field. I've always been passionate about new technologies merging the medical, more traditional medical way to treat the cancer with the technologies. So being able to deliver the systemic treatment with the classical chemotherapy or tablets and whatever is appropriate for the patients. Then I used to, I love the idea of also combining radiation treatment and target the cancer itself with the most updated technique. I've started to use the brachytherapy, so radioactive material directly into the tumor. And then, of course, my interest grown into the technologies such as the MRI-guided machine to deliver more and more precise targeted treatment. And of course, that brought me also to be interested in theranostic, so it means radioactive treatment from inside the body, delivering this good radioactive sort of material that killed the cancer from inside. So I guess clinical oncologists gave me the opportunity to look after my patient as a whole and not need any other professionals that can help me deliver bits and pieces of that treatment. I can actually follow the patient from the diagnostic process towards the end, through all of the pathway, through all of his needs of having different type of treatment that I can deliver myself. Clearly, knowing that you can help someone with cancer is the most rewarding thing. So caring for the patient, make sure that they are keeping their quality of life. If sometimes they cannot be completely curable, and sometimes the cancer is very aggressive, but making the difference in their daily life is the goal. Of course, having also the possibility to cure them with different with different treatment is very rewarding, because the time that they sit in front of me and I can say, well, actually, it's all cured, the cancer is gone, is the most beautiful sensation for me, looking at their face. It's also make me passionate about teaching the new generation in doing that. So I've also taken a role of a tutor college for the new registrar, the new trainees in oncology. So kind of teach them what is the most important things in oncology. Is just looking after your patient as a whole, not just as a number. And that's what I think make me go in and being able to support all of their needs, not just a simple treatment that we can all give. I believe I do value their feedback a lot. I do value their understanding when the situation is difficult, and the fact that they do trust me, because it's all about trust. I also think they feel the same and they do trust my judgment. And what I always very happy to hear is when the patient tell me that I take time for them to be in clinic. I don't rush them. I just simply listen to them and make sure that I address everything. And I'm really focused on the quality of life. So I, of course, focus on treating the cancer, cure the cancer, but I'm always passionate about what is left. So once I treat you, what it's the rest of your life look like. I don't want to leave you with side effect from the treatment. So I'm always looking into the whole journey. So I think they do value that, and I definitely value their feedback and what I can do to improve their experience and their journey. It's not a mantra, but it is about the I just try to not give up ever, whatever happen. And this is why I say to my patient, despite sometimes things can look bad, never give up. There is always something to do. There is always a solution that we can find together. So this is generally my way of dealing with things, finding the solution, not looking at the problem, but try to find what we can do about it.